Good afternoon, and welcome to today's Side by Side with the Division of Mental Health, Developmental Disabilities, and Substance Use Services, Improving Our System Together monthly webinar. Before we get started, here are a few reminders about the webinar technology. Please make sure you're using a computer or smartphone connected to the internet and that the audio function is on and the volume is turned up. Please be sure your microphone is muted for the duration of the call unless you are speaking or asking questions. Questions can be submitted anytime during the presentation using the Q&A feature located on your control panel. We will answer as many questions as time allows after the presentation. American Sign Language interpreters and closed captioning options are available for today's event. The American Sign Language interpreters for today are Susan King-Lanier and Karen Magoon. For closed captioning options, select the closed caption feature located on your dashboard. To adjust the video layout and screen view, select the view feature located in the top right-hand corner of your screen and choose the view that works best for you. Today's agenda topics include introductions, and MHSU IDD TBI system announcements and updates. We will also discuss draft DMH DDSUS strategic plan. Our focus today is justice system investments. We will wrap up with a review of this year's side-by-side webinars, and then there will be time for questions after the presentation. At this time, I would like to turn it over to Kelly Crosby, Director of the Division of Mental Health, Developmental Disabilities, and Substance Use Services.
Thank you so much, Dina. Hello, everyone. Kelly Crosby here. And as Dina said, I'm the Director of the Division of Mental Health, Developmental Disabilities, and Substance Use Services. I'm really excited to be here today. I have the privilege of being in Bethesda, Maryland. I'm at the SAMHSA NASADAD conference. That's a mouthful, but many of you know SAMHSA is our federal funder. And this is one of the conferences, the big conferences we have every year, where I get to meet with our fellow state substance use directors. So it's really cool to be here. A lot of our substance use team is here today, and I look forward to giving you guys updates in some of the side-by-sides in the future about some of the wonderful things we're doing in the areas of substance use prevention, treatment, and recovery. So this is me, for those of you that don't know me. I've been in this field a very long time. It's what I've done my whole professional life. I've been with the department for about 13 years and in this role for a year and a half at this point. I'm a licensed clinical social worker, I'm a mom, and I am a person with lived experience, which is why I love my job every day. It's a privilege to do it. And as a social worker, I think in this role, my job is to really advocate and work with you to build the strongest public mental health substance use IDD and TBI system that we can in North Carolina. With me today is, if you go to the next slide, Stella Bailey is here today. She is our Assistant Director of Justice System Innovation. In a few minutes, I'm going to hand the microphone over to Stella. And at that point, I will let Stella introduce herself, and she's going to do the bulk of today's presentation. So we're very lucky to have her here today. All right, next slide, please. So I'm going to do a few announcements. And the first two are about things that we are honoring this month. I'm sorry, I'm getting ahead of myself. This is just a reminder before I get into those announcements about important things we want to observe in the month of June, just to remind folks about our community collaboration model. We have many ways that we are engaged with you, and our teams are engaged with you in all kinds of meetings and things you invite us to, things that aren't even on this slide. But we want to make sure that at a minimum, people who are on this call today know about ways to get involved and engaged with us. Every month we have these side-by-side webinars. Every month I meet with our State Consumer and Family Advisory Council, with the clinical team at our LMEMCs, with providers and their associations, as well as our hospitals, specifically the behavioral health personnel in the hospitals. So if you are interested in being involved in any of those meetings, all are welcome. Because in last session, we got a very specific large chunk of money to invest in our public behavioral health IDD and TBI system, we also have some very special advisory groups that are focused on all those different pockets of funding that we got. So you'll see across the bottom, we have advisory groups around workforce, both for peers and direct support professionals, for child behavioral health, for crisis system investments, and supports for individuals in the justice system. Throughout all of these side-by-side webinars, we've given you updates on the status of the funding, the investments in those areas, how things have been going with the advisory committees, and we will continue to do that as we are today with our justice update. But if you're interested in being a part of any of those advisory committees, you are welcome. So there's a link, there's a hot link in this sheet, and if you go to our website, you'll see how to sign up both for these webinars and any of our advisory groups. All are welcome. Next slide, please. June is really important for many, many reasons, but one of the things that we'll celebrate is Juneteenth in June. And I just wanted to use this as an opportunity to remind folks that this is an incredible time to celebrate the emancipation of enslaved Black people in the United States. It's also a time to celebrate the wonderful, incredible contributions of Black people to our society in the past and now. It's an important time for us in this field to recognize that Black and African American people are disproportionately impacted by racism and other inequities that can lead to or exacerbate mental health and substance use issues. So there's lots of inequities there. There are much higher rates of mental health issues and much lower rates of treatment. So one of the things we must be continue to focus on, and we'll talk about our strategic plan in a moment, is making sure that we're reaching everyone who needs services. We have a more equitable and inclusive system. We're making sure that we have providers and programs that are culturally humble and culturally competent and culturally inclusive. So we are reaching everyone that needs to be reached for services. So we will be celebrating Juneteenth, and thank you for all of you that are having events this month that you have created for the community and that you've invited us to. On the next slide, June is also Pride Month. So we're very excited to celebrate Pride Month here. And as a reminder, individuals in the LGBTQIAA+ community have contributed amazingly to our country, to our field, and we want to celebrate them and honor them. We also need to be mindful of the fact that people in the LGBTQIA+ community face disproportional discrimination, inequity, and also have much higher rates of things like mental health issues, suicide, substance use issues. Again, much of it directly related to the trauma that they face every day. So please let us celebrate our friends and colleagues and allies in the LGBTQIA+ community this month. But let's also take this as a time to really look at what we are doing to make sure that we are providing culturally appropriate access, services, and support to our allies and colleagues in the LGBTQIA+ community. Next slide, please. Two other things I want to remind folks of that we've been really focused on, and I cannot meet with you without reminding you about our Crisis to Care initiative. Hopefully folks have been paying attention to the different press releases that have come out, or even more important than those press releases, hopefully you have started to see in your community additional crisis investments. Several months ago, we launched the statewide Peer Warm Line with Promise Resource Network. It is amazing the response we have gotten to the Peer Line. Last month, we had 5,000 callers, which is extraordinary. We will continue to get the word out so people have someone to call. We also invested in someone to respond. So we invested more in some mobile crisis and co-responder models. So people with behavioral health expertise are able to respond to people in crisis in community and in their homes. Look for more of those funding announcements soon. We also invested $15 million in 9 new behavioral health urgent care. So now we have 17 across the state. Behavioral health urgent cares are 24/7 facilities, just like a medical urgent care. We want folks to know where these are in their communities. They're for kids and adults. They're for people who need to detox. And we want to make sure people know there is a safe alternative place to go rather than the emergency room. And lastly, we invested another $22 million in community crisis centers and another peer respite center in Wake County, which I'm particularly excited about. So these are small standalone community crisis centers. They're very much like inpatient units of hospitals. They're fully staffed with mental health crisis folks. They're for people with substance use issues as well. They're for people with intellectual and developmental disabilities. They are in places that we have very high rates of people waiting in emergency departments for mental health crises. So we've invested in more of these across the state. You will hear more about the Crisis Care Initiative over the next several months, because we want to make sure that we not only invested in these, but we're very clear to the general public where these opportunities exist, where people can call or to go for help. We want to make sure that the existing facilities are well-funded and well-known in their communities. And we want to make sure that these models of care are sustained in our communities. So you'll be hearing more about the Crisis to Care Initiative in each successive month. Next slide, please. I want to remind folks too about our Accessible Communications campaign. Huge shout out to our partners at the Consumer and Family Advisory Council and the state that people understand. The very first rollout of the accessible communications was on the tailored plan. And you remember, I think it was in April, we had our tailored plan side-by-side webinar. And we talked about the rollout of the tailored plan. We previewed some of our accessible communications materials, and they are live now. I sent them out to my whole big listserv of hundreds of people. They're posted on our website. Medicaid has them posted on their website. And they're really simple things like one-pagers and social media posts, so people understand the really critical things they need to know about tailored plans. Remember, tailored plan is just your new Medicaid plan. They're operated by the LMEs we know today. So Alliance, VIA, Trillium, and Partners, the same LMEs we know today. And for people on Medicaid, it will cover their mental health, substance use, innovations, IDD, TBI services, as well as medical and pharmacy services as well. But it will be the LMEs that we know and love. Really cool. I'm getting ahead of my slides, but in July, when tailored plans go live, we're actually going to have the LME MCOs, or who are operating tailored plans. So Alliance, VIA, Partners, and Trillium, they're actually going to be here on our side-by-side webinar. We're going to host them, and they will be the feature in our July side-by-side webinar. Next slide, please. So I want to cover one more thing, something that we just announced today before I turn this over to Stella. We just released our strategic plan for 2024 through 2029. Strategic plan. I know not everybody gets really excited about a strategic plan, but I'm really excited about it, because to me, the strategic plan is us saying, hey, the mission and vision of DMHDD-SUS is this. So our mission is building programs and services and supports for the state of North Carolina for people with mental health, substance use, intellectual and developmental disabilities, and traumatic brain injury. Our vision, though, is communities where everyone is supported to live a healthier and happier life. That's what we want to do with our policies. That's what we want to do with our funding. That's what we want to do in partnership with you, with LMEs, with providers. So that is our mission and vision. We're sending this out. You will see our principles as well. So you will see heavily infused in there. We want to promote across our system inclusivity and equity. People with mental health, substance use, IDD, and TBI are disproportionately disadvantaged across the board, just are. And that is compounded if you happen to be Black, African American, Asian American, so Black or brown, and you have mental health issues or intellectual and developmental disabilities. You're disproportionately not getting access to care or high quality care. And we need to do a lot about that. So you will see that the plan is infused with equity and inclusion. It's also infused with the notion of person first, or people with lived experience need to drive the plan. We want people with lived experience to define what our system needs to look and feel like, because we need a system that doesn't work for us up in Raleigh, doesn't work well for providers, it doesn't work for lawmakers, it works for people who use it. That's the kind of system that we need. Our system also has to be informed by quality. It's good to have access, it's great to have access, but it has to be high quality. Our services should be helping with two major things. Should be helping people move into recovery, so living their best lives, or helping people be included and integrated into their communities. So that's what our services should be doing, and they need to be high quality. So we're getting those kind of outcomes from the services we have delivered. And all of our services should be trauma informed. Again, we know people with mental health, IDD, TBI, and substance use are disproportionately impacted by trauma, so very much trauma. We need to make sure that our services, our crisis system, everything we're creating is recognizing that trauma and being a system that heals and helps people recover. Next slide, please. Our strategic plan has 6 critical priorities, which is to expand access to quality IDD and TBI services, prevent substance misuse and overdose, expand services for individuals in the justice system, strengthen the crisis system, promote wellness and recovery, yay, and strengthen the workforce. These are our 6 priorities. When the plan comes out, you'll see the 6 priorities. You will see all of the goals under the priorities. So if you look on the next slide, each of the areas will have goals and we will have example initiatives and measures. So when you see the plan, it has priority areas, it has goals, and it has measures of success. What we will be developing with you and between when it's finalized is that list of interventions. What are all the programs we're working on that are going to get us here? You know about many of them. We talk about many of them in side by side, but we want to make sure they're well spelled out in the plan so you know what our goals are, what programs that we are funding and supporting with you, with consumers, with LME MCOs, so you know where we're putting our money and we're putting our time and energy into policies and programs. And we will be really clear about how we're going to measure success towards our goals. So next slide will show you that it went out today. It is posted on our website. It's posted for the next month. There's a QR code and you can scan it, and we welcome all and any feedback. Please know that the strategic plan is a living document. I told you it was a 5-year plan because we need a plan and we need to stick to it. But that doesn't mean that year over year, as we measure and change, that it won't be modernized and updated with new goals, new metrics, new interventions, etc. But we feel like this is a good, basic, comprehensive vision for where we want our public mental health, substance use, IDD, and TBI system. Really excited about this plan. It is our state public plan. Welcome your feedback so we can make it final by August. So we want all your feedback by July. Next slide, please. So without further ado, I'm going to reintroduce Stella Bailey. And as a reminder, one of the areas that the General Assembly funded us last fall was to make sure that we were supporting people with mental health, substance use, IDD, and TBI who were involved in the justice system. We've had so many incredible meetings with all kinds of community groups and stakeholders, our advisory board, because we want to spend the money right and well. So Stella is going to share with you today. Stella leads all of our justice innovation work. She's awesome. If you don't know her, get to know her. And she's going to tell you where, after much consultation and thought and data research, we are investing some of the first year's dollars and also going to tee up some things in the future. So I'm handing this over to Stella.
Thank you, Kelly. Hello, everyone. I'm really thrilled to be here today to talk to you about our justice system investments. Most of my professional life has been in the UK, working in the National Health Service and local government public health systems. And at first glance, there are very different systems. And at first glance, that you could assume that. But working here and having the privilege of working with DMH DDSUS for the past 4 years, I've seen that there is much more that is similar. And that includes how our systems impact someone's ability to access appropriate healthcare services. So this is what we'll be talking about as we go through. So if we go to the next slide, please, we'll get started. So this expands services for individuals in the justice system, a key priority for our strategy, our 5-year plan. And what that looks like is increasing engagement in deflection and diversion programs. That means we're doing more before someone actually enters into a juvenile or criminal justice system. We want to increase successful community re-engagement. Those individuals that are in the juvenile or criminal justice system, that when they leave and they re-enter their communities, whether that's the original one or they choose to re-enter a new one, that we have all of the supports and services in place so that is successful. We want to increase the use of evidence-based programs for our youth involved in the juvenile justice systems. This is incredibly important. We know that there are a number of evidence-based programs out there for them. So making sure that those programs are accessible is key to our strategy. We also want to increase access to capacity restoration. So many of you will know that capacity restoration is a justice system intervention that seeks to ensure that someone has the ability to stand trial if they are accused of doing something. And often, as you will see in future slide, we'll describe this in more detail. That can take a long time. So revising our capacity restoration system, making sure that it is available in more detention and community-based situations is essential to ensuring access to that care. So if we move on to the next slide, you'll see that right now we are working with the historic investment in behavioral health. This year, state fiscal year 24, $29 million has been assigned for us to dedicate improvements, specifically building capacity in our local systems to improve diversion and re-entry. And in state fiscal year 25, there's another 70 million. That is $99 million dedicated specifically for improving outcomes for individuals with mental health, substance use, IDD and TBI. So we want to move on to the next slide, please. So you will see a couple of slides coming up where we're focusing on some composite examples of individuals in the justice system and how our current system is impacting them. This is Jack. He is in jail because he experienced a mental health crisis that led him to both being arrested and losing his job. He is waiting for an inpatient psychiatric bed to have competency restoration services. It's also known as capacity restoration. We mentioned that in the last slide. So that can take several months. And many of you on this call are aware that it can be a long time without services. But if he had had access to a range of different services earlier on, this may not be a situation that he's in now. So if we want to move on to the next slide. So the next question is, how many people does this affect? And unfortunately, it is a lot. We know that 60% of jails reported having had symptoms of a mental health disorder in the prior 12 months of being asked. Of those, 83% did not receive any care after admission. Also know about 68% of people in jail have a history of misusing drugs and alcohol, and often that's combined with mental health issues. They also tend to lack access to treatment while incarcerated. And then finally, compared to other North Carolinians within the first 2 weeks post-incarceration, these individuals are 40 times more likely to die from an opioid overdose. Many of these statistics you've seen before, they are changing, and unfortunately, they don't always change in the right direction. We have seen some reports that 40% is higher. We also want to make sure that these other statistics are accurate too, and we're working with all our partners to ensure that. So next slide, please. So this is our vision. Youth and adults with behavioral health needs deserve help, not handcuffs. And this is how we're going to do it. Our vision for achieving this is to prevent justice involvement by strengthening our pathways to community-based treatment and care. Right from the onset, and this is when you hear us talking about deflection and diversion, but this is also where our entire system plays a part. All access to community based care and treatment will have a positive effect. We want to effectively support our youth and adults with behavioral health needs through justice system involvement with evidence-based treatment. So wherever they are, whether it's right at the beginning of their justice experience or towards the end, we want to make sure that they have the best evidence-based treatment. And again, ensuring seamless re-entry and stabilization in the community, that is more than medical needs. It is housing, it is transport, it's natural supports, however that may come. So recognizing that we have system gaps, we're committed to improving that continuum of services and supports for both youth and adults at risk of or experiencing justice involvement. Next slide, please. We have another example here. We're going to focus on Sarah's experience. Sarah is a teenager living with a developmental disability and co-occurring substance use. She does not have consistent treatment providers, and she was recently placed in a juvenile detention center due to a probation violation. So what does all of this mean? This is a dense slide. I will summarize it. Many youth get a comprehensive clinical assessment. Sometimes in this Sarah's case, it does not identify appropriately her needs. She goes into withdrawal in the detention center. The clinicians try to get Sarah into treatment, but it's not possible. There are barriers there. And on release, Sarah then runs away from home and resumes using substances and does not have the ability to thrive or make choices that may lead her back to the justice system. What we want to see is that Sarah is a recipient of a standardized trauma-informed comprehensive clinical assessment. It's informed by her previous screening. She does not have to tell her story several times, and that story is understood. Sarah receives the substance use program that she needs, and when she's supported by her juvenile justice behavioral health team, who works with her treatment providers, her court counselors, her care manager, and appropriate community-based services. She's also working with her schools and the JJBH team to ensure that her plan is met and she's receiving all the appropriate specialized care and classes that she needs. This is where we want to move forward to. We have elements of this working now. We want to ensure that this is working comprehensively for all youth. So we move to the next slide, please. So this is what our first year investments look like. Our whole focus is improving the quality and consistency and really the support of our juvenile justice system. So first of all, we are investing in a new Credible Messengers mentoring program in our juvenile justice facilities. It is a nationwide program where its evaluations have shown that it's a mentoring program that youth have shown significant improvements in reconnecting in their communities, of employment opportunities and education. We are incredibly excited about this opportunity. We're working together with our Division of Juvenile Justice to ensure that this is a reality. It involves bringing in some specialists from Washington, D.C. who have rolled this out in other states. And it also involves developing a cohort of trained specialist individuals and to do the mentor problem of what is called Credible Messengers. The next intervention that we'll be focusing on is really improving the effectiveness of our juvenile justice behavioral health partnerships. There are 21 partnerships covering all counties across our state. It's an incredible network full of local specialists who really understand the needs of their youth. But what we want to do is really shore up that network, make sure that it is functioning effectively, that the provider network supporting the JJBH teams is responsive to their needs, particularly around our behavioral health substance use needs within our youth. We're also doing some work to expand the Secure All Firearms Effectively, NC Safe campaign. So this is part of the gun safety awareness campaign that's been rolled out across the state. We are working with our partners at Department of Public Safety to invest a little bit on that program and expand it to other areas using all routes that we can to ensure that our youth are being protected from, securing our firearms effectively. Sorry, I fluffed that a little bit. Let me try again. Our secure all firearms effectively is known to help reduce access to and use of firearms that may be stored inappropriately. So it's about knowledge and awareness of how all firearms owners can be part of helping reduce the gun violence, and it also distributes gun locks and safes. So we're really excited about doing that program. So next slide, please. So we're going to move to adults. Just as a quick note for those of you interested in what we're doing with our youth, there will be more to come. That was just the initial first slice of investments, and we'll be able to give you more information over the next few months about other plans. So we'll move to our justice-involved adults now. And we'll talk about John. John lives with co-occurring mental illness and SUD, who's experienced homelessness and is arrested for trespassing on residential property. He is held in jail for his first court appearance. He's convicted for trespassing. He is not screened upon entry to either jail or the prison facility. And whilst his LME MCO attempts to in-reach prior to his re-entry date, his release date changes and he's suddenly back out into the community and can't be located. He's very quickly arrested again. So what we want to see in the future is that John is diverted to a recovery court in his county, that his needs are identified at that point, at that early point, and he receives treatment through a forensic assertive community treatment team to help meet his needs and his participation in court. This FACT team links him to stable housing, helps him with employment, he has access to a peer support worker, and he achieves long-term stability and integration. So how do we see this happening is our next point. So we move to the next slide. So we have been working on this for several years. Between 2020 and 2023, we had invested in a number of community-based programs for diversion and re-entry. That's so about 10,350 individuals, 79% through diversion and about 21% through our community re-entry programs. We got individuals connected to substance use disorder treatments, connected to medications for opioid use disorder. We saw 5%, only 5% rearrested as part of that program, and over 17,000 naloxone kits distributed. There were some reported overdose events. Most were known to be reversed. Now, if we move on, so what we want to do and intend to do over the next few years is really build on those successful outcomes. So that looks like expanding our re-entry programs, and that includes housing and workforce investments. That is more people dedicated to identifying individuals who are re-entering. That's working with our partners at Department of Adult Corrections and within the local jail network. And also we're increasing our peer support through our various different re-entry programs. We want to see an expansion of our detention and community-based capacity restoration services. We are doing more to do the re-entry transition supports. Again, this is through our partners with the Department of Adult Corrections. And that also includes expansion of IDD TBI programs across the whole interface of diversion, deflection, and re-entry programming. So what does this mean? And we have a nice visual here for you. just looking at some specific examples, and we're going to go back to John's story. John is waiting in jail, perhaps for several months, to receive capacity restoration services, some of which includes treatment services for his serious mental illness. So by implementing more community and detention-based capacity restoration centers, we'll see an increase availability at our state psychiatric hospitals. Less use of our emergency departments whilst people are waiting there for a bed in the hospital. And it means improving access and treatment improvement for a number of our populations affected by the justice system. Will also reduce recidivism, stabilizing individuals, meeting their needs, meeting their social deterrent needs, housing, employment, treatment, and care will help reduce those recidivism rates over time. So this is a critical area. Relatively small population, essential to improving our health and well-beings of our communities. We want to move on to the next slide, please. This is another one of our investments. We talk about our transition from prison to community and expanding our transition services. I want to talk about North Carolina Fit Wellness, our formerly incarcerated transition program. Some of you are familiar with. They do reentry services for physical health care and substance use disorder. They worked with us in a previous year to pilot a very specific program called Fit Wellness, which is dedicated to providing wraparound intensive support within reach for individuals with serious mental illness. It includes access to physical health care too. And the clinic also provides an on-site food bank that is run by a trained social worker. It has peer support and a range of other services, wraparound services. So as part of building up our transition and expanding what we know works well, we are expanding new sites to Orange and Durham and New Hanover counties. This also includes, which is something new, is a psychiatric residency program. So which will conduct these clinical rotations through each site. This is really exciting. We do not have enough clinicians, enough psychiatrists to meet the needs in our population. Many of you will be aware of how this is impacting access to care. This is going to bring us at minimum 5 new clinicians through who are going to have dedicated experience specifically with this population. And so we've seen a lot of success in this. We've seen a 98% enrollment rate. 62% at the last report was Black and African American males. 39% of these participants have received housing assistance. They've been connected to Medicaid. They've received substance use disorder treatment in addition to the other psychiatric care that they've needed. And these policies and programs, we're working with our colleagues over at DHB to see how this will work and inform the 1115 reentry waiver. And really, one of the key outcomes we're looking is increased access to the medication in those first 2 weeks post-release. And as you all know, it's not just access to medication, it's access to those individuals and wraparound support that goes with that medication that keeps folks stable. Next slide, please. So capacity restoration expansion, we mentioned that before. Just now we referred back to Jack's example. And our money that we've received in the budget includes expanding the detention center capacity restoration program. Currently it's running in Mecklenburg with 10 beds. That's going to increase to 25. And it will also accept individuals from surrounding counties. We'll also look at opening new detention programs in Wake and Pitt counties. So what have we seen that makes us want to expand this? Of the 32 incapable to proceed defendants that have participated in year one, 80% received restoration within 45 days, which is 4 times faster than they would have experienced if they were to receive those same services at the state psychiatric hospital. And that occurred at 1/5 of the cost of the hospitalization. So what's next? In addition to opening up an additional beds in Mecklenburg, we're working with Wake County and Pitt County, both to open up another 10 beds in each county. So next slide, please. So I also want to talk to you about upcoming funding opportunities. There are a number of things that we're doing, which are about really looking at data-driven, equitable services. We will be releasing a request for funding proposals for our community-based diversion and re-entry projects, really build that capacity across our state to serve our justice-involved individuals, whether that be youth at risk or involved in the youth justice system, or adults to deflect or divert or support them with re-entry. So please bear that in mind. You will see more of that information coming up. We also wanted to talk about the pending 1115 re-entry demonstration request. Should that go through, that is with our CMS federal partners right now, waiting for approval and their feedback. But it includes $315 million for capacity building funding for justice programs. That is down the line somewhere, but please remember that as you think about your local communities and how you strategically need to get from where you are now to where your ideal vision will be, supporting individuals and ensuring access to care. And that is our side-by-side. If there's any, I'm sure there are questions, but back over to you, Kelly.
So we're going to do a side-by-side year in review, just to remind folks where we came from and where we are. But before we do that, let's go and let's do the Q&A now with Stella. And we also have Tracy Ginn on, who is also from our Justice Innovations team. We got some fantastic questions. And so while this is still fresh in folks' mind, I want to ask these questions now. So Stella, you want to come on camera? And Elliot's gonna ask, he's gonna grill you with some questions.
So this first question is for Tracy, who hopefully can come on camera. We wanted to give Stella a chance to take a break before we asked her a question. So Tracy, if you could please speak to the role of naloxone and other medications in supporting individuals at risk of an overdose who are released from jails and prisons.
Sure thing. And Stella can also speak to that question. Go ahead, you could go off camera. Stella, you can just back me up on what I say. So yes, that is a very critical component to what we're working on with the different contracts and in the investment money moving forward. As Stella mentioned in one of the slides, that there's such a high risk for individuals that are exiting the correctional facilities who have who for overdose after they've left. So we are working on with the SOR grant, as well as developing more in that for our community programming grants that there will be more of for investments moving forward. Both involve naloxone and other overdose interventions. Stella, did you want to add anything else to that?
Just to say that it has proven to be a really successful and critical element of our previous contracts. And it is essential life-saving equipment. You wouldn't think twice about having a defibrillator in a business. You should not think twice about naloxone. It is essential for the work that we do.
Thank you, both Tracy and Stella. Stella, this one is for you. You highlighted the importance of housing. Could you speak more to the role of a program like Forensic Act that offers stable housing and supporting individuals who are re-entering the community?
Mhm. So one thing a Forensic Act team will do, which is very similar to our ACT teams that work with complex care, but Forensic Act teams have specific experience and staff members with experience of the criminal justice system. So this is for adult care, and our FACT teams will be they understand the importance and the difficulties too that this client group will have accessing housing. And part of their future remit as we build up those FACT teams is to ensure access to those housings, however that may look. Now we're reviewing a number of different strategies on that which our FACT teams will connect with, including new and emerging strategies around rapid rehousing as well as traditional transitional housing approaches. We are leaving no stone unturned in our ability to ensure that kind of stability. And we welcome input to however that may come on what housing should look like.
Thank you, Stella. Another question for you. Could you say a little bit more about what a recovery court is and what makes these different from other programs?
So a recovery court is the new term for traditional mental health and drug treatment courts. Our administrative office of the courts, our AOC, where there is a program dedicated to improving the number of these courts across our country, have changed the name to recovery courts. It is the traditional drug treatment court, family drug treatment court, mental health court. And they are working with a completely separate strategy, but alongside running parallel on strategies to improve the number of those courts and the consistency of how those courts operate. And that's important for us to know because we're looking at building up the capacity in those same counties for individuals to be referred to services or be referred to like a diversion or deflection service through the same route.
Thank you, Stella. Tiana, who is our juvenile justices team lead, question for you. Could you please speak to what a JJBH team is, or Juvenile Justice Behavioral Health, hopefully I got that right, team is and what they do?
Yeah, thank you for that, Elliot. So our Juvenile Justice Behavioral Health Partnership works to support state and local teams across North Carolina, and the main goals are really to increase access, effective treatment engagement, retention, and community engagement for young people with behavioral health challenges. And so across the state, we have 21 local teams that cover the entire state that really work on our local levels to connect young people who may have justice involvement to mental health and behavioral health services in their communities. And so that can look like assessments, it can look like referrals to services like MST. It really varies from community to community, but these local teams are really working with our other partners, with DJJDP, DSS, to really get these young people connected to the services that they need. I hope that answers it, Elliot.
And the one thing I would add to what Tiana said is that thank you so much. Tiana's a rock star. We didn't introduce Tiana before, but also a member of the Justice Innovations team here. Teams can look different, but one of the things that we're working to do is make sure that there is some consistency for families and also juvenile justice to know what to expect, because we want to be a really good partner. So we want to be able to explain to them and court personnel, like, this is who the person is you can contact in your community. This is what they can do in terms of coordinating and helping families. This is the network of services that are developed in your community. Because we've heard that loud and clear that sometimes the system can, the whole system, not just the juvenile justice or behavioral health juvenile justice system, can be confusing. And so we want to take that element out of it, like be really clear about who they can connect and the kind of services they think they can offer. So we're excited about using that money to offer some consistency, predictability, and just good education to communities.
Yeah, and one more thing I'll add really quickly because I see a comment. So the JJBH teams do like that direct intervention, but also part of it is that prevention element. And so working with our community partners to ensure that youth have access to services prior to any potential contact, or even at the lowest level of like a referral to a court counselor, that they are diverted away from that legal system. And so there are elements within our local teams that prioritize that prevention aspect as well.
Thank you, Tiana. Stella, a question for you. You shared that you were excited about the 1115 reentry waiver. Could you say a little bit more about what this is and what it means for this population?
Mhm. The 1115 Medicaid waiver, part of it seeks to provide reentry coordination starting at the point about 90 days prior to release, and then after it's coordinating the care. So it's reentry planning for all justice involved individuals, regardless of whether they have behavioral health or physical health needs. So one, that's incredibly important. But we also know that it improves access to treatment for individuals who are in prison right now, who may be and in future prisons. But so many will have behavioral health needs. If it's not mental health and substance use, it will be IDD and TBI. And this intervention and the infrastructure that needs to be implemented to make sure it moves forward is really essential for improving access. So, and in addition, so I don't forget this important element, it also includes medications for opioid use disorder. And it also includes ensuring that there's 30 days worth of prescriptions in a person's hand as they leave. And this is incredibly important. We know that lack of medication during those first few weeks and months sometimes after someone leaves is literally a life and death situation. So this is great. This is why I'm excited about it. It's I know there's a buzz about it. I do know that it's going to take a while, but we are all working together to really maximize the opportunity.
And
I get really excited too about, I'm sorry, Ellie, I also have to give a plug about the fact that people in the justice system on re-entry, I think I have to get this right, are also eligible for the Healthy Opportunities pilot. That's transportation, that's food, that's housing, that's huge. I also want to give a little bit of a plug for that too.
And Stella, thank you for sharing a little bit about the re-entry waiver. Could you speak to what the timeline for that might look like?
So we are still waiting for our federal partners at CMS to get back to us on that one. Once that's approved, and it could take a couple of months to come through. So we're kind of talking winter time. That may come with some action points for us to do. And when I say us, I mean the state. Overall, DHHS may need to do a few things before it gets implemented. So we may be talking a year. We may be, I don't know what the time frame is. It could be a lot quicker. We are ahead of the game in many ways in this state. So it's really hard to put a definitive time frame on it, particularly if there's not someone from DHB to help back me up on that. But for those of you who are familiar with the 1115 waiver, and we might be able to circulate some links to our fact sheets on DHHS.
Great idea.
You'll see that there is a time frame where we're working with prison reentry, and then after that's done, that comes to jail and juvenile justice. There may be some movement in some of that. It depends on how well and how quickly we can get our infrastructure moving. And a lot of it depends on infrastructure, how our systems work together, what data is collected, that kind of thing.
And Elliot, we need to finish out the presentation, but I want to add one thing to what Stella just said, to also just to offer a little hope, but also to really recognize the team and also all the communities who have, despite not having this waiver, have been doing everything from making sure that we're getting treatment while folks are incarcerated locally or in state prisons, who are providing reentry supports. So there are so many people across the state, and Stella's team leads a lot of this work using federal funding, other funding to get really creative. And so thanks to all the providers, thanks to the LME MCOs, thanks to Stella's team, all the communities who are working on these types of programs now, we've learned a lot from these programs. And being able to fund that reentry and services while someone is incarcerated is great, because it frees up some of our funding to also pay for other things that support people's successful reentry, like housing, like transportation, like employment services. So team's done a lot of work. So I would say we are preparing in many ways for the 1115 waiver, and as much as we can, providing as many services as we can now to people who are in prison and jail. So thank you so much, Stella and Tracy and Tiana and Elliot. I'm going to wrap us up. We have just a couple more slides I wanted to wrap up. And so the first thing I wanted to do is just do a really quickly side-by-side year in review. Now, when I say a year, it's because our state fiscal years run from July through June 30th. So we're getting ready to wrap up all the side-by-sides we've done in this fiscal year. So as you recall, we actually started these back in September. We really thought long and hard about, we had webinars, but we wanted to make sure that we had a place where we were really being transparent and giving updates to the community. So we started that back in September. As you recall, we actually had an introduction to the leadership team here at DMH DDSUS, so you could learn who we were. And over time, we've talked about some really critical initiatives like Inclusion Works. We've talked about funding for the crisis system for individuals in the justice system. We talked about some workforce programs, direct support professionals and peers. And it was really cool because we had direct support professionals and peers come and do a panel with us, which was really cool. In March, we did our child and family behavioral health investment. We teed that up for folks. And that's really cool because it's a whole departmental collaboration. DSS was here, DCFW was here, our colleagues at Medicaid. So that's showing you how we are working together with you to make really important and much needed investments in our child behavioral health system. We talked about tailored plans in April, more choice and inclusion in May. As a reminder, next month, we're going to have our LME colleagues here because it is the launch of tailored plans. And so they're going to share lots of wonderful information from you, and they're very excited to be here with you today. What really stands out to us is how many folks are tuning in. We have roughly on average 400 people tuning in every month. We're very grateful for that. And we're grateful for you. Lots of you send in feedback after the webinar. We use that to improve these webinars all of the time. Our wonderful interpreters, Karen and Susan, were giving us some feedback prior to starting today's presentation. So we want to make sure that we're doing everything from the right content, the right pacing of the content, that we're just meeting the needs of the community, because that's what these webinars are for. We want to get information to you. We want to ask questions. We want to be accessible because that's important. It's important that we work side by side and we work on our public mental health, substance use, IDD, and TBI system together. So thank you so much for joining us. Next slide. Here are ways to stay connected. Here's the QR codes for side by side. If you're not signed up, you probably are, and that's why you're here. But please, there's the sign up to the QR code for our advisory committees, and we have a mailing list. We send stuff out at least once a week, if not more. Also, folks sometimes send us things, announcements to put in the mailing list. Feel free to do that too. We can get some announcements out if you need us to get announcements. Next slide. And that is it. We did our Q&A already. And I really want to thank, again, Stella Bailey in particular. Great presentation, Stella. Thank you for your leadership, Tracy for your leadership, Tiana for your leadership, and the whole Justice Innovations Committee, our Justice Advisory Committee, and all of our partners across the department in the community who are doing such amazing, thoughtful work to support people with mental health, substance use, intellectual developmental disabilities, and traumatic brain injury who are involved in the justice system. We want to create a system of healing and help, not handcuffs, and we want to make sure people are getting the treatment they deserve. So thanks so much for joining us today, and we look forward to seeing you next month when we'll be here to talk about tailored plans with the CEOs of our LME MCOs. All right, thanks so much, everyone. It's great to see you all today.